Hello, dear all. Thank you for your interest in our webinar on the use of medicinal mushrooms in integrative oncology. I am Esteban Sinde, Chief Research and Innovation Officer at Hifas da Terra. We are the leading EU company in the development of medicinal mushroom products with an expertise based on more than 20 years of experience. The syllabus of this presentation is as follows. First, we will begin with a brief introduction to mycomedicine. Then, we will review how medicinal mushrooms work and the modern science behind them. We will see some clinical cases of cancer patients treated with myco-oncocare line. Then, we will give some tips on how to choose a high-quality nutraceutical and the characteristics of our products, which will be distributed in volume platform. Finally, we will close the session giving a hint about our company. Let's first take an overview by looking at some of the history behind mycomedicine. The concept of mycomedicine or mycotherapy is defined as the use of extracts and active biomolecules obtained from mushrooms as medicines or health-promoting agents. Mycotherapy has been used in Asian countries for thousands of years and include more than 100 medicinal fungi species. It has been widely employed for treating different kinds of disease for thousands of years. But since the discovery of the famous fungal extract penicillin by Dr. Alexander Fleming in 1928, researchers have realized the significant antibiotic and other medicinal values of fungal extracts. Medicinal mushrooms are well known to be biological response modifiers. They counteract the tumorigenic microenvironment. They have immunomodulatory effects and improve the metabolism of many organs, thus reducing the cytotoxicity and side effects of conventional oncological treatments like chemo, radio, and according to new evidence, even immunotherapy. And in combination with these usual treatments, medicinal mushrooms contribute to the improvement of the quality of life in cancer patients, reducing unwanted side effects. In addition, positive results in terms of remission and improvement in life expectancy are also reported in many trials. Here we see in this 2021 review about the concept of mycomedicine, the main actions of medicinal mushrooms, such as anti-tumor activities, which include cell cycle arrest, apoptosis, autophagy, and anti-angiogenesis effects, the regulation of oxidative stress, the reversion of multi-drug resistance, the improvement of the immune response through cytokine modulation, and the regulation of gut microenvironment. This last one meaning that mushroom compounds are prebiotics capable of modifying the intestinal microbiota composition, which has been linked to the expression and progression of different kinds of cancer, like colorectal or even breast cancer, among others. And what are the main bioactive molecules behind medicinal mushrooms? First, beta-glucans, which have immunomodulating, prebiotic, and anti-cancer function. Triterpenes, such as the well-known ganoderic acids from reishi, with huge anti-inflammatory activity, and the hericenones from lion's mane, among others, which help stimulate the synthesis of the nerve growth factor and the myelination of neurons. They have also a complete essential amino acid profile with 17 amino acids, peptides, and proteins, vitamins B, C, D, and E, and many minerals such as iron, zinc, magnesium, or germanium. The sterols are main group with ergosterol as the highest precursor of vitamin D. Statins like natural lovastatin that helps the lipid modulation, and also polyphenols, basically very strong antioxidants. Well, in the second part, we're going to present the scientific evidence of medicinal mushrooms in cancer. Hereby, I give you a hint of the oncological applications of some of the main medicinal mushrooms. Reishi is the first one, recognized as an adjuvant to conventional treatments, considering its potential to enhance tumor response and stimulate host immunity. Shiitake, in a review of 9,400 lentin and associated cancer treatment case, showed a solid effect of this extract in improving the quality of life and promoting the efficacy of chemotherapy and radiation therapy during cancer treatment. Maitake showed in some phase 2 studies its beneficial immunomodulatory potential, and polyporous polysaccharide showed a potential immunomodulation in bladder cancer therapy. Regarding other mycotherapeutic scientific evidence, lion's mane polysaccharide showed a prebiotic function demonstrated in a randomized double-blind placebo-controlled oral intake, where we saw a significantly improved cognitive function in the patient. Cordyceps extract demonstrated in a randomized double-blind clinical trial an improvement of the immune system function and the diminishment of inflammation parameters. Agaricus blazei extract were used in gynecological cancer patients, reporting significantly improvements in the quality of life, like appetite, emotional stability, or general strength. Also in chaga, we have some studies that demonstrate the continuous intake of this aqueous extract suppressed cancer progression and maintained body temperature. It is important to remark that these clinical trials and many others were published in some of the most important scientific magazines like Cochrane, the British Journal of Cancer, or the Anti-Cancer Research. In Hifas da Terra, we also contribute to science. And in this PubMed paper, we proved that extracts from Hifas da Terra showed the capability as adjuvants to common chemotherapeutic agents in clinical practice by increasing their cellular toxicity, the inhibition of processes characteristic of metastasis, and the direct inhibition of the proliferation of colon tumor cells. As you see in this graphic, the adjuvancy of myco-May and myco-Corio with 5-fluorouracil, a classical chemotherapy, showed that this extract combined with the chemo increased the cell toxicity even at low concentrations of this chemotherapeutic agent. In this microscopic picture, you can see the effect of our extract on tumor cells even at the morphological level, reversing the mesenchymal morphology towards the epithelial morphology characteristic of healthy tissues. In other trial made with our extracts, we demonstrated an anti-migratory effect on colorectal cancer cells. And I would like to also highlight the importance of the modulation of gut microbiota in cancer patients. This is an abstract presented by us in one of the most important cancer supportive congresses worldwide, the MASCC, celebrated this June 2021, where we also presented a study with colorectal cancer patients that afterwards, in the next part of my presentation, we will see in more detail with the clinical results for both study cases presented. Now, let's have a look on our Myco-Oncocare products and the trials behind them. The Myco-Oncocare line is based on synergies of the commented medicinal mushroom extracts with anti-tumor activity. We have developed this specific line for cancer patients based on our clinical results by the experience, feedback, and testimonies we have received over more than 15 years of work with cancer patients, therapists, and oncologists in 5 different European countries. Today, we can announce that we have started the recruitment of patients in our breast and colorectal cancer trials, being the first company in Europe to promote these studies in public hospitals with mycomedicine products. The 5 products of our Myco-Onco line are MycoDigest for colorectal and digestive cancer, MycoMama for breast, ovarian, gynecological cancers, MycoMen for prostate, MycoPni for lung, and Myco-Onco, a general anti-tumor support for other types of cancer. Fungi-derived proteoglycans and terpenoids from Hifas da Terra are biosimilars to PSK or lentinel products, which over more than 40 years of clinical practice demonstrated non-interaction with chemotherapy drugs and even a synergistic additive effect, obtaining better results than chemotherapy alone. Here we can see the clinical cases presented in the 2021 MASCC Congress, meaning CRC colorectal cancer patients and BC breast cancer. In this study, we showed that this patient taking our Myco-Onco extracts during the cancer chemotherapy treatment did not develop peripheral neuropathy, very common in this type of patients, or only in a grade 1, a mild tickling in palms and soles lasting only for 24 hours. Mood improvements were also reported by the patients. In a second study presented in this same Congress, we also demonstrated an improvement in the quality of life of gynecological cancer patients and also an absence of peripheral neuropathy induced by these chemotherapy treatments like carboxyplatin plus paclitaxel. The median rate of quality of life in these patients was around 8.5 over 10. This is another case study sent by an integrative therapist following a man diagnosed with prostate cancer in UK. The patient was treated with mycotherapy adjuvant to the chemo with 1 vial and 1 capsule per day of mycomine. In subsequent months, the dose was increased to 2 vials and 2 capsules due to the high PSA value and metastasis present. In successive analysis in December, January, and February, a significant decrease in the PSA value was observed, and the patient reported feeling well in general, pain-free, cheerful, and with no need to get up at night to urinate. In this other case study, a man diagnosed with lung cancer in April 2015 was treated with chemotherapy for 4 months, and then with an immunotherapy treatment, nivolumab, for 6 months. The side effects were persistent fatigue, loss of energy, and reluctance and continuous weight loss. He began an integrative treatment with ketogenic diet, and as mycotherapy supplements, he used mycopne and mycopolypor. After 1 month treatment, the result reported by his oncology was that the neutrophil count raised from 1,500 to 2,500 in May, the best result that his oncology saw during the whole treatment, thus demonstrating the beneficial immunomodulatory effect, even in adjuvancy with immunotherapy. In this slide, I want to present you our exclusive Hifas da Terra microsalad line. The composition is 100% concentrated mushroom extract, formulated regarding scientific evidence and know-how. This is the line we use for active support of subacute complaints and chronic condition. We are now implementing a new glass packaging in all products, like shown on the 3 first products, for sustainability and non-microplastic penetration reasons. From this range, our prevention protocol recommended after an oncological treatment is Mycocurio PSK during a couple of years after the conventional cancer treatments in order to prevent recidives. Hifas da Terra is the only lab that has the PSK trademark registration in Europe. Our exclusive PSK extract is unique in the world, and there is extensive evidence of the beneficial effects on cancer survival rates, improvement of immune function, and reduction of tumor-associated symptoms. We also have a cosmeceutical range based on our mushroom extracts to avoid dermatological secondaries, often caused by chemo or radiotherapy treatments. This support treatment should be used before, while, and after conventional treatment cycles. Here we see 2 amazing clinical cases, the first one caused by chemotherapy with taxanes, and the second one showing an extreme cirrhosis in hands caused by immunotherapy. In both cases, treated with MycoQT, we can see a full remission after 3 and 5 weeks of treatment, respectively. And here, in this slide, I resume the quality of life improvements we can expect with our mycotherapy treatments. First, the contribution in repairing the digestive system lining, normally harmed by the treatments. Another effect is rebalancing the intestinal microbiota, plus an improvement of regular transit, gradual regulation of appetite, reduction of nausea, and increased interest in food. We can also see an improvement of alterations in taste and smell sensation, very common in cancer patients. Regarding fatigue, we can expect a significant improvement of general well-being and muscle strength. And another aspect of massive importance is the prevention of this peripheral neuropathy we were talking about, that provoke numbness and nerve damage, and we can, with mycotherapy, avoid or having a clear improvement in the patient's sensitivity. In this 4th part, let's now take an overview in the scientific evidence by looking at some of the advances that Hifas da Terra is doing with our myco-oncoline trials. In first case, this is the micro-marker trial, a final phase of a collaborative R&D project developed by Hifas and supported by the Spanish Government Council for Research. It's a double-blind, randomized, placebo-controlled trial in 144 colorectal cancer patients supplemented with Hifas da Terra MycoDigest. The trial evaluates our new formula of MycoDigest in relation to rate of post-operative complications derived from colorectal surgery, the effects on gut microbiota, the systemic inflammatory and immunomodulatory parameters, and the effect on quality of life, digestive well-being, and nutritional profile. Another clinical trial beginning this year is called Microimmunomama. Its main hypothesis is that the micromama supplementation can enhance the immune response of breast cancer patients and help the microbiota regulation of the intestinal tract altered by the oncological treatments. Micromama can also potentially reduce the side effects and could therefore be a coadjuvant to standard breast cancer treatment, and also used as a preventive to reduce the risk of developing or recurring breast cancer. Well, now in this fifth part, let's talk about the importance to choose a high-quality medicinal mushroom nutraceutic. In order to work with mycomedicine, it is important to understand in depth the ecosystem in which we find ourselves today. A study from 2017 worryingly revealed that only 25%, so 1 in 4 medicinal mushroom products on the US market contain the state amount of reishi. The other 75% products contained no mushrooms at all. These facts, published by Nature, reveal an unethical practice and give us a clear message of the importance that a patient sticks to a specific prescription and not change to any type of brand, regarding that not all products are made with the same rigor. To see results in our patients, in Hifas, we produce formulas with an exemplary quality and 100% traceability. Here are the recommendations offered by IMMA, the Integrative Mycomedicine Association, which defends that a high-quality medicinal mushroom nutraceutical should meet, preferably, the use of certified organic medicinal mushrooms. Vegetable capsules suitable for vegetarians, vegans, celiac, and lactose intolerant people, total traceability, the guarantee of concentration and stability, a maximum concentration of active molecules, and most important, the scientific evidence behind the brand. And now let's take a look at Hifas da Terra. Hifas is the leading biotech company in the development of medicinal mushroom-based products for human health. Our expertise is based on more than 20 years of experience in studying the clinical applications of mushrooms. We allocate 62% of our profits to research and development, and we have now more than 15 active in-house clinical studies underway, including the 2 controlled clinical trials in oncology we have seen at public hospitals. We try to make the difference with our myco-quality system to assure a total traceability from cultivation to final product, a triple analytical check for safety, purity, and concentration of molecules, and this include microbiological parameters, 400 pesticides, heavy metals, and gluten analysis. We also have a strain selection system based on one of the largest banks of fungal strains in Europe, which allows us to select the most suitable strain for each product developed, and also an exclusive concentration system called the Hifas green extraction system. Regarding the absorption of conventional drugs, this is normally through hepatic cytochromes that do not coincide with the cytochromes involved in the assimilation of our fungal preparations. In fact, the Medina Foundation study evaluated Hifas da Terra's own fungal extracts and has validated that they have a very low risk of interaction with other drugs, since they are not metabolized by these cytochromes such as P450. And let me also remind you that for those professionals interested in more resources of mycotherapy, we invite you to join our privileged club for healthcare. So I invite you to join in our club, and I want to remind you the Hifas advantages. We are the only European mycotherapy company with clinical trials on our product. Our myco-quality system is a warranty for traceability, quality, efficacy, and safety. We produce 100% concentrated organic extract with no drug interaction demonstrated. Our nutraceuticals come from organic certified medicinal mushrooms, and we are Europe's largest medicinal mushroom biotech with the aim of delivering the highest concentration of active principles in our products. So please, if you have any questions, write them now or contact our mycotherapy advisors team. And again, thank you so much for your interest.